Ashish, am I audible?
Yes, Dr. Isha.
Okay. So Dr. Shilpa is there. Good evening, Dr. Shilpa. Dr. Shilpa, there has been an issue with Dr. Jamana. There has been some family emergency because of which she won't be joining the session. So I'll be moderating the session for today. Everything remains the same, and she told me that you will be sharing a presentation.
Right.
So, doctor, the questions will be answered via that, or it will be something other
No,
than the.
first I'll just finish off the briefing about glaucoma and then we'll take questions.
Sure, then we'll start after the first question. Once you have briefed, then you can just share the PPT.
Right.
Understood, doctor. Fine. Let's wait for Dr. Bhumika as well.
Huh.
Dr. Shilpa, I think so it's time that we start our session now.
Oh, yeah, sure, we can start. But Dr. Bhumika isn't yet joined, right?
She'll be joining in some time, so she's asked us. Meanwhile, we can just initiate.
Okay, great, sure.
Yeah. So, hello everybody. Good evening. Myself, Dr. Isha Ryundi. I'm the Marketing and Communications Leader at QurHealth. And I will welcome you all for our today's webinar that is on the topic glaucoma, understanding the progression and complication of the silent killer. Our guest speaker for today are cataract and glaucoma surgeon Dr. Shilpa and senior dietitian Dr. Bhumika. Firstly, for those who don't know about Cure Health, I would just like to give a brief about our company. At Cure Health, our vision is to save lives super proactive. We have developed QurBook app with more than 200 care plans and diet plans that are under 30 different health categories. These plans help you to monitor your vitals, your symptoms, and everyday lifestyle management activities are specified as per your health condition. We have Sheila P featured in our app who acts as an AI-based healthcare assistant, and she can record your vital symptoms, activities, and answer your questions and query that you have related to your health conditions. Under Cure One Care Concierge program, we have highly trained nurses as our care coordinators who remotely monitor your health conditions and help you take a regular follow-up on your care plan activities, your medications, your healthy food, what food you are eating, and that comes under the diet plan. Our newly introduced product, Cure Home, has also made its way into the system that is a Bluetooth enabled device connected program that automatically records your vital whenever you use these devices. And before we start our session, I would like to introduce you to our esteemed panel of chief speakers for us today. Dr. Shilpa, she's a renowned ophthalmology surgeon in Bangalore with cataract and glaucoma surgery specialization. She did her MBBS at Al Amin Medical College, Bijapur, and completed her FRCS Part A Surgical Fellowship examination and has pursued her diploma on ophthalmic medicine and surgery, DOMS degree, from Karnataka Institute of Medical Sciences. She did her DNB in ophthalmology from Bangalore West Lion Super Speciality Eye Hospital. In 2001, she completed her glaucoma fellowship in medical laser surgical management of glaucoma for Aravind Eye Hospital, Coimbatore. Currently, she's a director and cataract and glaucoma surgeon at Aastha and Vardhman Super Speciality Eye Hospital. She is also a visiting consultant for glaucoma services at Akshara Eye Foundation, Tumkur, and Purna Eye Hospital, Chintamani. Previously, she worked as senior consultant for glaucoma services at Netradam Super Speciality Eye Hospital, Bangalore, and has served as medical consultant for glaucoma services at Aravind Eye Hospital, Coimbatore. She has various publications and conference paper presentation to her credits. We are honored to have you with us, Dr. Shilpa.
Thank you so much.
I would like to also introduce you to our next guest speaker, Dr. Bhumika. She is a famous dietitian at Lucknow and is founder of Nirvana Diet Clinic. She has clients around the globe and provides diet consultation with diet plans for American, British, Australian, Canadian, and Gulf patients. She has more than 18 years of experience in the field of food sciences, nutrition, and biochemistry. She did her B.Sc and M.Sc in food sciences and nutrition and is a university gold medalist. She did her Ph.D. at Central Food Technology Research Institute, Mysore, and has more than 10 research publications in international journals. She has received NET, JRF, SRF, and UP SLET fellowship from her research work. She has had thousands of patients around the globe through diet and research work and lifestyle changes. She has expertise in designing personalized therapeutic diet for patients with diabetes, dialysis, hypertension, cholesterol, PCOS, chemotherapy, radiotherapy, IBS, food allergies and GI disorders, arthritis, jaundice, cirrhosis, weight management, and many more. As an invited speaker, she has chaired many national and international conferences of food sciences and nutrition. She's closely collaborated with CRPF, corporates, hospitals, NGOs, and institutions. Thank you for joining us today's webinar, Dr. Bhumika.
Thank you so much, Dr. Isha, for the kind introduction.
Thanks, ma'am. Thanks. Before we move on to the main webinar, I would like our audience to know that if they have any kind of questions, they can write it during the webinar in the comments section, and these questions will be taken at the end of the session. So before we begin our session, I would just like to brief a few lines about glaucoma, what exactly the condition is that we're talking about today. Glaucoma is the second most common cause of blindness worldwide. In 2020, about 80 million people had glaucoma, and this number is expected to increase to 111 million by 2040 worldwide. WHO has estimated that 4.5 million people are blind due to glaucoma all over the world. Talking about India, glaucoma is the leading cause of irreversible blindness, and at least 12 million people are affected, and nearly 1.2 million people are blind from the disease. Unfortunately, many individuals are unaware of the existence of the condition. A better awareness could prevent this visual disability in many people. Hence, at today's webinars, we'll be focusing on the glaucoma and we'll be love to make some more awareness among our audience. So, Dr. Shilpa, my first question I would like to start with you is please let our audience know about the various causes of blindness and kindly elaborate on glaucoma condition, its types and symptoms.
Sure. I'll just go through presenting what is glaucoma, and because most of them perceive it in a very different manner, or they just assume it something like as common condition as a cataract or a reversible condition. So I would just like to tell them briefly about what is it and what are the causes and what are the treatment modalities available. So I would be sharing the screen. Just a second. I'm able to share the screen, just a second.
You could have, we saw a little bit glimpse of the screen. I think so you'll have to just do it the similar way you did.
Okay.
We are now able to see your screen. Oh, it just went.
No, just a second. I'm just not able to go to the presentation person. Now can you see? Now can you see the screen? No,
Not yet, Dr. Shilpa.
No.
No, Dr. Shilpa, we cannot.
Okay. No, this is the updated version of Zoom, so I'm not able to share the screen. I'll just probably talk the same thing what is there on my screen. Is that okay?
Yeah, Dr. Shilpa, that would be great.
Okay. So what the glaucoma is second leading cause of blindness, as you already mentioned there, and so it causes the cause for the glaucoma nerve damage is due to the elevated intraocular pressure. What is the intraocular pressure? Something like our blood pressure. We have a pressure inside the eye, which is called as intraocular pressure. So the glaucoma occurs because of the alteration of this pressure. So it damages the peripheral vision first and then progressively engulfs the central vision also, leading on to, in the advanced stages, only the tunnel vision will be remaining. So magnitude of the problem, as Dr. Isha already pointed out, that the problem is going to increase up to 111 million by 2040 worldwide. And of course, in India, if we take, about 12 million are already affected. So that is the amount of problem that we are facing when we are looking at glaucoma. So we need a multi-pronged approach to tackle this silent thief of sight. Why it is called a silent thief of sight? It is a silent thief of sight because the patients are unaware generally in the initial stages what happens in the eye, and they come to know about the loss of vision only in the later part of the disease. So that is why it is popularly known as sneak thief of sight. But there is nothing to worry, like it is not a blindness that cannot be cured from there on. So it is nothing like the patient has to panic, but people have to be educated and have to be careful regarding what are the causes. We don't say exactly the causes, those are more of risk factors for glaucoma. So what are these risk factors? Risk factors is the most common risk factor is the age. Why aging population tend to have more glaucoma? Because as it is, I would say it is more of a systemic condition that comes into the eye. So I would relate it as a more an eye being a part of the body, and so also there's a variation in the eye pressure also, and that would affect the vision in the long term. So aging, increased age itself is one of the risk factor, and a strong family history in the first degree relatives of their own family members. If anybody is suffering from glaucoma, be it any type of glaucoma, can run in families. But the inheritance pattern depends. So some may be affected, some may not be affected, some may be severely affected. So that you leave it to the eye doctor. But family history is a significant risk factor. So next comes the extremes of refractive errors, what we call it as high myopia or high hyperopia, short-sightedness or far-sightedness. Earlier it was just that myopia only causes glaucoma, or myopic eyes have predisposition to glaucoma, but no, even hyperopia or the far-sightedness also is a risk factor for glaucoma, because in Asian population, we being short-statured and our eyes are also a little smaller than the Caucasian race, than the Western race. So our eyes definitely have a crowded outflow channels, and that the high hyperopic patients or the people tend to have glaucoma. And eye injury, next common cause is eye injury. Any kind of injury, like in the initial stages, maybe you just ignore it as a simple eye injury, but the impact on the eye would be such that the drainage of the fluid from the eye is affected, and thereby it can lead on to high pressures and glaucoma in that particular eye. So the only difference between inherited glaucomas or primary glaucomas is they happen in both eyes. This trauma can predispose glaucoma in only one eye, affected eye. So after the eye injury, next comes the as I was telling you, it's a more of a systemic condition. So diabetes, hypertension, migraine, thyroid disorders, hypothyroid disorders, and cardiovascular disorders. All these problems can predispose to glaucoma. So these are not exactly direct causative factors. So any person who is having to glaucoma is more in diabetic population or hypertensive population. So that's the reason all these comorbidities, we have to keep screening for diabetic retinopathy as well as glaucoma, or hypertensive retinopathy as well as glaucoma in these eyes. So I would say a comprehensive eye evaluation after 40, probably every year, should be advised on the basis of early detection of these conditions, which can remain silent. So these were the causes or the risk factors. Now, what are the manifestations? How the patient can perceive it? Some patients do complain of headaches, vague headaches, when their eye pressure goes up, or when they have a little reading difficulties, or frequent change in the glass power is itself indicative of glaucoma. So these kinds of conditions are very subtle. So patients may ignore that, okay, these can be due to other causes. But then when we screen them, they turn out to be related to the pressure rise or high pressures. So next comes acute glaucomas, in the sense where the pressures can tend to go up really double times or triple times. Then the patient complains of absolute blurring, severe headache, eye pain, and they most commonly can land up with the physician, but then the problem is in the eye. So when the physician screens out everything and there's nothing, no problem related to their specialty, when then they see there's an eye problem, and we record a very high pressure, because that can present as vomiting, nausea, and dehydration as well. So these are the extremes of glaucoma, but these symptomatic glaucomas only constitute say up to only 5 to 10% of the normal glaucoma population. So these are the presenting symptoms. So next comes how do we identify? How do we detect glaucoma? So we have various testing strategies. Once you come to the ophthalmologist, we check the vision, normal vision. Intraocular pressure is the most important factor that we look into, and it has to be recorded accurately, because we have so many recording devices. But the glaucoma specialists rely upon the contact mode, the gold standard Goldman applanation tonometer. So once we record the pressures, we categorize the glaucoma, whether it is primary, whether it is secondary, and whether in primary, whether it is open angle or a closed angle glaucoma. So based on that, we advise them medications, laser treatment, and surgical therapies are also there. After the pressure recording, then we look into the angles. What are angles? See, most of the times the patients have a doubt that when we advise a laser treatment as a preventive measure, then it is out of blue, they have no problem, they have no symptoms, and doctor is advising a laser treatment. So they're all utterly confused. So the problem there is don't know the disease. So it takes a lot of chair time on the doctor part to explain to them what is glaucoma and why there can be a pressure rise, and what we do when there are narrow angles. So to detect the narrow angles, we do a test called gonioscopy and see if it is a narrow angle, then we can widen it up and prevent the occurrence of glaucoma in these set of patients. Then comes the secondary glaucomas. Just a second. So in secondary glaucomas, what happens? Usually there's an underlying problem. So that has to be tackled, and along with that, intraocular pressures have to be managed to control. What are the secondary conditions? Symptoms of diabetic retinopathy, extremes of hypertensive retinopathy can land up with secondary glaucomas. Now, eye injuries, as I told, cracker injury, shuttlecock injury, cricket ball injury, any kind of eye injury is termed as a secondary glaucoma. Or any eye surgeries, some traumatic eye surgeries, retinal surgeries, or retinal detachment surgeries with vitreous substitutes in the eye can land up with secondary glaucoma. So these are the testing modalities. Once we identify, classify what is the glaucoma, then we move on to field test. What is field test? Why it is so important? Because glaucoma never damages the central vision. The patient can have 20/20 vision even up to the late stage of glaucoma. So the early changes of glaucoma can be detected only in the field of vision, what we call it as perimetry. So patient is unaware, because the side vision or the peripheral vision, usually they don't use it for long in many of the conditions. Only people who are actively driving, they can detect early subtle field changes, and then they present with a field change. Otherwise, it gradually constricts from the periphery slowly and then involves the central field also. So that is why to classify glaucoma, whether it is mild, moderate, advanced, severe stage, we need field test. So when fields have to be periodically repeated to know the course of the disease, because it is not just one-time diagnosis, one-time treatment, and then it is over. No, it is your lifelong disease, and the responsibility of the doctor rests with restoring the vision for the entire lifetime. So whether the treatment is working, whether the disease is stable, has to be periodically assessed using this field test, and then we have scans also to see the nerve head changes, and we document both structurally and the functional field loss over a period of time. So that is why field test plays a very important role in the diagnosis as well as the follow-up management of the glaucoma patient. So next comes the scan. What we have to document is the nerve. Sometimes the field test cannot be really reliable. Suppose we have a patient, elderly patient, 80 years old, and we ask him to do this the field test. It is a challenging test on the patient because they have to really concentrate and respond to the stimulus wherever it is given. So it's slightly challenging on the part of the patient. So that's why we depend on the objective test. So the patient doesn't participate. We just record what is the eye condition. And then we record it. Again, same like field test in the initial visit, then on the follow-up visit to see the disease is stable with our treatment. See, the most common problem that happens in glaucoma patient is the detection part and the first treatment part is all okay. Once the patient comes back again with the controlled pressures on medication, then they're happy. And after that, they stop the drugs and there is no follow-up. So that problem comes, the challenge is more towards enhancing the compliance and adherence of the patient to the treatment as well as the follow-up. I think your app can do that, and probably if a glaucoma patient can get enrolled in your app, you can send reminders or refills for their medications and for the follow-up visits so that they keep a track of glaucoma, what's happening. And during these COVID times, when patients were not really accessible to the doctors, so we have seen a lot of patients coming with very high pressure glaucomas and having lost almost total vision in their eyes. So that is the situation when the patient doesn't come. Even if the patient is on medication, is on treatment, it becomes difficult for us to ascertain the nature of the disease, whether it is stable or not. So that's why this comes, the follow-up part comes into play. So next comes after the treatment, the most common treatment modalities, of course, the eye drops or the eye medications. We have a variety of medications at our hand to treat you. But then when it comes to laser, again, the patients have a lot of concerns about how safe is the laser in their eye. I would tell you probably it is pretty much safe, and lasers are for various purposes, not just for glaucoma. So we can do a laser and prevent actually angle closure glaucomas to quite an extent in about 70% of cases of angle closure disease. So after laser, we have surgeries as well. When the patient is not a fit candidate for any of the medication or lasers are not working or not going to be helpful, then we have surgeries. So surgeries also, there are quite a lot of variations, and then the doctor discusses with the patient for that. But any modality of treatment, whether it's medication, laser or surgery, cannot be just a one-stop solution for the patient. So they have to remember that even if a patient has undergone surgery, they have to keep following up with the doctor to check if the pressures are normal. I would actually advise them to say it is just like the hypertension and diabetes, where they keep taking the medicine and keep getting it tested every, say, 6 months or so to see if it is under check. So these are the changes. So we need a multi-pronged approach to tackle this public health problem of glaucoma. I would say next only to cataract, this is the problem that has to be prevented. It's kind of a needless blindness only, but then we have to focus on the awareness of the glaucoma and their different types and whatever I have said, and what are the treatment options, and we have to demystify the myths which are currently existing. And of course, the rest of the team, the rest of the work lies with the medical team, the doctors, the residents, the training part, and the optometry level for widespread reach for the glaucoma patients. So this is a brief introduction about the glaucoma and what is its consequences. So probably we would go with the question answer session as Dr. Isha will take it further.
Sure. So Dr. Shilpa, that was extremely, informative of what you just, told us about the condition, the types, as well as the symptoms. There do happens to be, one of the questions that comes up, why it is more prevalent among the older population? Why are they the higher risk category over there? If you can just elaborate something on that.
Yeah, see what happens, there's a fluid, the aqueous humor, that keeps circulating in the eye, and the secretion part of it remains constant. Say from birth till death of a patient, the secretion keeps happening, and that is needed. It's like blood circulation in our body. So it nourishes the intraocular structures, the lens, the iris, the retina, and everything. So that fluid has to keep moving. So once the secreted fluid gets stagnated, that is what happens with the aging. The outflow channels are really tiny and very fragile structures. With aging, what happens is these structures become narrow, become loaded with extracellular material, we call it. That happens, that leads on to functional block. So once the drainage is not happening, then the secretion keeps continuing. So that's why the pressure gets elevated, and then the pressure rises. Leads on to glaucoma. But then in angle closure disease, there's a structural block, in the sense the fluid doesn't have an access to the outflow channels at all. So that happens in a very small eyes, narrow eyes. Generally, that's what I was saying. Southeast Asian races are very prone for these kind of angle closure diseases.
Okay. So that's the main reason, I think. So that was one of the prime question that keeps on cropping. So moving on to Dr. Bhumika, I would like, some more light on the diet part here. So my first question for you would be, Dr. Bhumika, can you explain our viewers why diet plays a role when it comes to eye health, and what kind of foods are recommended for that? What we say about good vision.
See, balanced diet and lifestyle, like you asked, diet for eye health. I would rather say that balanced diet and lifestyle are the main factors that are responsible to prevent most of the diseases and ailments. Now, generally, it's said that these eye-related problems are related to the age, or it's due to strain, that eye is getting too much of strain because of work on computer or TV and things like that. But again, I would say that our diet and lifestyle are much of a culprit. Like previously, I don't think that we are going into a very, very sedentary type of lifestyle. It's like we want to lie in an AC room, we want to sit in an AC car and go to our work. Then again, we want to eat the meals out of the box. We don't want to cook fresh meals. So that's where the problem arises. These sedentary lifestyle and out of the box meals are not providing us the adequate nutrients that are actually needed for our vision and overall health. Now, since we are talking about vision and the eye health, so there are a few components, nutrients like beta carotene, lutein, zeaxanthin, to be more particular. These components are very crucial to be there. It should be there, inherent part of our diet to to make the diet a well balanced thing and take care of the overall health. Now, it's very important to take a stroll in the fresh air. It's very important to look at the present colors. These things are going to help in the long race. Uh, Now, in diet, when we talk about the components vitamin A, vitamin E, vitamin C, these are the vital vitamins that are very crucial for eye health. Particularly beta carotene, that is found in carrots and pumpkins and cantaloupes and beetroot. It's very crucial. But again, there is a misconception that if you are eating a carrot, your vision is going to improve. Whenever we eat a carrot, it's not going to be absorbed completely. But if most probably, if you eat a raw carrot, hardly 5 to 10% of beta carotene will get absorbed in your system. Rest 90% is going to be a waste. Now, why is that happening? Because we are not able to absorb the beta carotene that is inherently present in a carrot. Therefore, consuming a lightly steamed veggies, especially when these or beetroot or broccolis, when they are lightly steamed, it becomes more bioavailable to the system, and then it will be more beneficial for us. So when we are saying the children to just eat a carrot, or even when we are we are having a plate of salad, remember to steam it next time. Second, most crucial factor for the vision is eicosapentaenoic and docosahexaenoic acid, to be specific, that is omega-3 fatty acids. Now, these omega-3 fatty acids are mainly found in the animal food, in egg yolks, in fish, to be more specific, in sardines, tuna, mackerel, basa. These fish are very rich in omega-3 and omega-6 fatty acids. So EPA and DHA are very crucial to prevent the conditions like glaucoma, to reverse the conditions if it is in a very initial phase. First and foremost, if your diet is very proper, if it's containing all the adequate nutrients, you won't have to face the conditions like glaucoma. Once it's you already have glaucoma and it is in initial stage, if timely checkups is done, as Dr. Shilpa also told, okay, the initial checkups are very crucial. So if it's timely diagnosed and then the treatments has started, we can very easily treat it and reverse back the condition with proper medications and diet. Even when the condition progresses, diet has a very crucial role to not let it recur. Recurrence level can be reduced. It won't advance at that faster rate. So these fatty acids, beta carotene, these factors are very crucial. But now coming to the next question, I know it's going to be like, okay, this is about the non-vegetarian. What about the vegetarians? Vegetarians always have that question. Okay, how are we going to get the proper protein or proper beta carotene or proper omega-3, omega-6? Now, in this case, vegetarian meal is a bit compromised because in vegetarian meals you don't have EPA and DHA in adequate amount. You have ALA, it's another omega-3 fatty acids, alpha linoleic acids. You generally get ALA in vegetarian or plant-based food, which is metabolized to EPA and DHA. But for that, you need to have this ALA in quite high amounts. So for the vegetarians, the best sources would be to have nuts. To be more specific, walnuts, almonds, pista, cashew, Brazil nuts are the best sources of ALA. And then legumes, beans like kidney beans, soya bean, chana, chole, chana dal, these are the rich sources of ALA as well. So these can be converted in the body to EPA DHA. But then again, I would suggest to consider the option of cod liver oil also, if especially if you are facing the condition of glaucoma. So these things will reduce the complications as well. But we, like at our clinic, we always say let food be your medicine. So I always say to have it in a fresh form rather than in the form of pills, especially for multivitamins and multi-minerals. You never need a pill. You can always complete that intake by your diet itself. Copper, magnesium, as Dr. Shilpa was saying, that the pressure needs to be maintained. Now, to maintain the pressure, the balance between the sodium and potassium is very crucial. You need to have adequate amount of potassium, adequate amount of magnesium in your diet to reduce this IOP, intraocular pressure. So these things, if it's there in your diet, if it's taken well care of, then you won't have any complications and we can easily reverse back the condition if it's initial stage, and always manage it quite well even if it is in advanced stage. Over to you, Dr. Isha.
Sure, Dr. Bhumika. I think so. The answer that you just gave us has given us a lot more, understanding of, we had only one thing, carrot, carrot, carrot. But, when how you told, it's to be steamed to get properly absorbed. I think so that is something that the viewers will be really taking it up. As you just mentioned, when it comes to glaucoma, the fluid intake and your salt and potassium balance has to be maintained. Are there anything specific you would recommend for these glaucoma patients who are suffering from it or who have just, come out? How would you, propose the diet to them? If not something very elaborate, some few elements that can be added over here.
Very true, Dr. Isha. This is a very good point that has been taken up here. Actually, too much of water at the same time is going to harm. You can have 2.5 to 3 liters of water throughout the day, but let's say within half an hour, we shouldn't be consuming a liter of water. So the fluid intake has to be well balanced throughout the day, and the consumption of alcohol and caffeine has to be cut down. Caffeine is going to create a problem. Alcohol is going to create a problem. Too much of tea, like there is a fascination about green tea. Well, that's not a fascination that I would say to get addicted to once or twice a day is another thing for its polyphenol or catechin content. But too much of green tea also, I would say it's going to harm the thing. So you can easily have 2.5 to 3 liters of water, but it should be well distributed throughout the day, not at the same point of time. Like some people have the habit of drinking 2 to 3 glasses of water at the same time. You shouldn't be doing that. Secondly, coming to the salt intake, normal consumption, a normal person, you and me, should be taking around 2.5 grams, milligrams of salt, sorry, 2.5 grams of salt, 2500 milligrams of salt per day, say half teaspoon. But for glaucoma patient, again, because the pressure, there is a risk of increase in the ocular pressure and even blood pressure will worsen the condition. So you should cut it down to 1.5 grams per day. That would be my recommendation.
Thank you, Dr. Bhumika. And switching back to Dr. Shilpa, I have few questions that are specific to glaucoma here. You just mentioned there are surgeries for, for glaucoma to be corrected. What are the exact post-glaucoma surgery precautions that a patient should be taking?
See, actually, most of the times the time duration for surgery is more or less like a cataract surgery. Okay? When we are doing a glaucoma surgery, the more common surgery that we do is trabeculectomy. So it lasts for about, say, 25 to 45 minutes in different hands. So the surgery is kind of a little more delicate than the cataract surgery here, because the healing time and the post-operative care is little prolonged, because we have to balance the outflow from the eye, and we should not be having low pressures as well. So that becomes very critical. So we would regulate the pressure outflow with sutures. So once the sutures are in place, the patient should not rub their eyes and should avoid sleeping on the side of the eye operated. So they can sleep either supine or on the other side. And the most important thing is they will have a bit of suture irritation, but the doctor explains to them, and then progressively it just reduces. And once 2 to 3 weeks are the most crucial weeks post-operatively. 3 weeks once it is over, once we time the suture removal, then the patients are most of the times comfortable. But still, I would say the settlement of a surgery would take up to 4 to 6 weeks. And I would like to, Dr. Bhumika was, as she was already mentioning, that most of the Indians have that habit of drinking about a liter of water in the morning. So that should be probably avoided, because we do it as a water drinking test, and it is called a provocative test for glaucoma. So we see a immediate spike after the large bolus of water intake. So they can actually, split it over the day, but a bolus should not be taken. And it's and any aerobic exercises definitely improve on the blood pressure, eye pressure. So though it's a transient effect, but then definitely we see in aerobic exercises, we have documented evidence that it will reduce the eye pressure as well for about 20 minutes to half an hour post exercise. And the other thing with respect to exercise, if I have to mention, head down postures like Shesasana, Sarvangasana, and Yogasana can increase the eye pressure. I think so. Also in hypertensive individuals, these postures have to be avoided. In cardiac patients, these postures have to be avoided. That is the most common queries or the patients come up with when they are doing all these exercises or yogasanas more commonly.
If I may add to it, even the weightlifting and boxing exercises are going to increase the pressure over there. So you have to be under proper guidance if you are an athlete or a boxer or a weightlifter.
Correct. I do agree with that.
Sure. So I think so. We do now have, some ground rules over here when it comes to post-surgery to glaucoma. Dr. Shilpa, the people do say, post-glaucoma surgery, there'll be some kind of vision loss. So is it true that there is a vision loss, or is there a partial vision loss, or are people able to restore their vision? There are these common myths that that tend to happen when it comes to
Yeah,
glaucoma. If
right.
you can just
I will.
elaborate on that, ma'am.
Correct. See, actually, the early to we classify the glaucomas based on the field damage, early, moderate, severe, and advanced disease. So when we have early to moderate glaucomas or some kind of advanced severe glaucomas also, when we are operating, the post-operative IOP fluctuations can transiently blur the vision. So that is reversible kind of disease. So once 4 to 6 weeks, once the pressure stabilizes, the fluctuating vision goes off. So the vision remains stable. But whatever damage has happened till then, that will remain the same. But in very advanced stage, when the patients, even the central vision is also involved, or we say one quadrant of the fixation gets involved. So these patients are at high risk of permanent visual loss after surgery, because the abrupt lowering of the pressure eats away the remaining cells in the eye, which are contributing to the vision. But having said that, I would say that this risk, what we see, is very, very minimal. Say, I should say 0.03% of such glaucomas who are operated land up with this complication. I don't deny that there is no chance at all, but as any surgery has its own setback, so also this setback is there. But when we weigh the long-term benefits of the surgery in preserving whatever vision the patient has, I think taking that risk is still worthwhile, because in that 0.03%, again, some percent do recover their preoperative vision by about, say, 6 weeks. So I don't deny that there is no possibility, but there is a possibility, but this should not create a scare of or going ahead with the surgery, because anyway the patient will be losing the vision with high pressures, with unattended problem in the long run. So if we just take that amount of risk and reduce the pressure, at least the existing vision the patient can save.
Okay, so thanks for clearing that particular myth that we had. If I talk about one more question that I have regarding glaucoma, we have talked about the treatment and everything, but nothing on the prevention. If we talk about what preventive measures can be taken by the high risk population and those who are not at high risk to avoid it as a future complication. So if you can highlight that as well here.
Yeah, the high risk population, definitely, as I told you, all the risk factors, the aging, of course, maybe after 40, or if not 40, after 50 years at least, if you have no other risk factors like family history, diabetes, hypertension, migraine, so on and so forth. But then if you have all these factors, especially with the family history of glaucoma, you need to get, we have a kind of guidelines for that. After 40 years, maybe if you don't have any symptoms of glaucoma, then every 2 years is the follow-up duration. After 50, the follow-up duration gets reduced to 1 every year if you don't have the disease. But once, if we detect any disease in this stage, say 40 to 50 or above 50, then the disease is classified as early, moderate, severe, and then the follow-up is accordingly more frequent. So you have to get it tested. The only state of prevention, what I would say, is early detection, because it is very impractical to treat a patient assuming that the patient is going to have glaucoma. So that is only prevention that we have is for angle closure disease, when we see there's an narrowing of the angle and which is at high risk for closure and high pressures. So only those patients we do a preventive laser iridotomy. That's the only preventive measure we have for that particular type of glaucoma. But for the rest of the glaucomas, it is more of regular follow-up, periodic assessment, and early detection.
Okay, so what we should take from the answer is early detection is the key to prevention.
Yeah. So even if you don't have any problem, the periodic assessment, the responsibility of the periodic checkup rests with the patient itself.
Thank you,
So
Dr.
I would
Shilpa, for
actually
that.
tell my patients, when you come back for a periodic follow-up, that itself is a prevention for them from glaucoma.
Correct. Rightly said. Rightly said. Switching Dr. Bhumika, there is a thing that people say, vitamin E very significant when it comes to glaucoma condition. Can you just share some, words of wisdom here when it comes to vitamin E, and exactly how people, should not be making it just the thing for glaucoma, and what exactly is the significance?
Vitamin E has the antioxidative properties. Now, when we say that vitamin E has antioxidative properties, it's very crucial to understand that vitamin E is fat soluble vitamin. So you shouldn't be cutting down on your fat intake as the people are doing nowadays. Don't eat this, don't eat that. True. Trans fatty acids are going to worsen the condition. Trans fatty acids, in the sense, fried foods or cakes or pastries or very simple, they provide high of trans fatty acids. But you should have good amount of uh, monounsaturated and polyunsaturated fatty acids, because these help in the absorption of the vitamins as well, especially of vitamin D and vitamin E. Now, vitamin E has the antioxidative property, and therefore it might help in improving the condition. What are the food sources of vitamin E? Coming to those, mostly the seeds, the chia seeds or sunflower seeds or pumpkin seeds. These are the rich source of vitamin E. But again, remember, nowadays the things that we are getting in the market is the roasted and salted variety that we keep on our table, dining tables, and open and just eat it. So there, while frying, while you are roasting it, half the nutrients are already gone. So whenever you are taking these seeds, remember to have it in the raw form. Maybe you can keep it sunlight if you want to keep it for a while. But you should never roast it for long time to make it crispy and taste better, and then add salt. There you are just spoiling all the nutrients, the inherent nutrients, plus the additional salt intake is going to create all the more problem. So yes, vitamin E is very crucial. It main sources are your these seeds, nuts, and legumes again. So I would always say do keep a check on your diet. It should be colorful as possible. Each color fruit, each color vegetable has a particular pigment, like beta carotene is the yellowish orangish pigment. Similarly, there are many other pigments. There are lycopene, there are zeaxanthin. If you are making sure that your food bowl or the plate, your meal plate, is having green color, is having orange color, is having red color, is having yellow color, you are taking care of most of the nutrients of your diet. And do remember, whenever, like vitamin C, in addition to vitamin E, vitamin C is also as crucial. But vitamin C, whenever you heat or boil it, we lose it. It's lost. So adding lemon is not the only source of vitamin C. Vitamin C is generally found in citrus fruit, but source, there are oranges, there are pear, there are kiwi fruit, there are guavas, there are tomatoes. All these are of vitamin C. So you can always add these in your diet. Consume raw, consume lightly steamed veggies, and make it a part of at least 50% of your each plate, be it dinner, be it be of lunch plate or breakfast plate, and it will take care of most of your nutrients over there.
Thank you, Dr. Bhumika. That was really a very, I would say, you have answered a very big fad of, roasting stuff and all. I was also doing that, by the way. So, but thanks for that. So now we are heading towards our Q&A session, where our audience have already started putting up the questions. I would just pick few that we got while we were talking about the webinar. One is, one of the patient wanted to ask Dr. Shilpa, I think so you could be the better person to answer. What causes macular degeneration and how it can be prevented? Is it something associated with glaucoma or not?
Actually, age-related macular degeneration is an entirely different entity. It may coexist with glaucoma, but not exactly related to glaucoma. In fact, we say that the macula, which is responsible for the central vision, remains healthy in glaucoma patients. But then age-related macular degeneration, because the question came up, it is mainly because of the degeneration of the macular cells or the retinal cells that happens due to more common UV exposure that is the prime cause, I should say. But it can run in families, more commoner in Caucasian race, white population. Luckily, we Indians are in the black race or mid race. So that's why the melanin pigment is kind of a protective for age-related macular degeneration changes. And fortunately, I think we are in a safer zone when compared to this disease prevalence compared to the West. As Dr. Bhumika was telling, the EPA, ALA, and those kind of micronutrients do play a great role in preventing this age-related macular degeneration, which affects the central vision, in contrast to glaucoma, which affects the peripheral vision. So coexisting glaucoma and macular degeneration is kind of a disaster for the patient because they lose the peripheral as well as the central vision. So I think the diet considerations for macular degenerations should be well taken, and that can prevent long-term visual deterioration.
Thank you, Dr. Shilpa. I think so that was really insightful here. Another question that the viewers asking is, if a person has migraine, frequent episodes of migraine, along with visual impairment issues, should they worry about glaucoma? Is migraine glaucoma something?
Yes, migraine is a kind of a risk factor for glaucoma. What's the actual pathology behind migraine is the vascular dilatation or that happens, and that is episodic, periodic. So that itself can alter the eye pressures, and eye pressure, I should say that it is not a constant figure. It is not like a constant phenomena that happens in the eye. Like a blood pressure, it keeps varying. It keeps varying throughout the day. We call it as diurnal variation. So the diurnal variation itself, the ups and downs, peaks and troughs itself can cause glaucoma. So glaucoma is not just high pressure. It is just the variation in the pressure. Extremes of pressure variation can also result in glaucoma.
Okay. One more question that is frequently, people are having is, nowadays the corporate section is sitting on their laptops working for 8 to 10 hours constantly. So, and they do frequently come up with issues of itching, tiredness, red eyes. So, will this also be a positive factor towards glaucoma in the coming future?
No, not exactly, because I do get a lot of patients who want to work on systems, or who are still glaucoma patients who are still active and want to pursue their profession. So looking into screens or doing their vision related tasks will not contribute to glaucoma or will not deteriorate glaucoma either. The main problem there is when we give them medications on the long term, they would have dry eyes probably, because that the system usage or the screen time will predispose them for dryness. So when we are coexisting glaucoma and the medications that are going on, the OSD, ocular surface disease, or the dry eyes is more. So the patients will have a lot of discomfort using the screens. So we advise them to take breaks or use some preservative-free lubricants we give them. Intermittently a lot of water, or the best thing is every 20 minutes or 30 minutes, just take their eyes off screen, just go around and walk around, then come back. That's how the circulation also is intact, and the eyes also are little less strained. So they have to give it in breaks and use their glaucoma medicines as well regularly.
Okay, thanks, Dr. Shilpa. Now, Dr. Bhumika, I have a very interesting question for you. One of the user wants to understand, can only diet help me cure glaucoma?
No, only diet can't help you treat glaucoma once it's already caused. It can be prevented. I always say it's better to prevent than to go for a cure. So try to have a healthy diet and lifestyle so that you don't face that condition. But once you have glaucoma, we can try to treat it at the initial stage itself. We should try to treat it at the initial stage, because at that time, minimum of medicines and diet will be able to help you reverse back the condition. Once the condition is advanced, then diet can only help you not to proceed the condition, not to worsen the condition, and medications will help you to reverse it back.
Yeah, to extend what Dr. Bhumika already mentioned, it's just not the diet, your control of systemic conditions, whether you control it with medicines, with diet, or whatsoever, but your diabetes, hypertension, those things have to be controlled and monitored, because we have seen glaucoma fluctuate very weirdly in patients with high blood sugars. When the blood sugars come down, then the medications work properly and the pressures have a constant range.
Yes, blood sugar, hypertension, in addition, even the increase in weight is also resulting to the cases of
Right.
glaucoma.
Yeah, the increased weight will result in what we call it is obstructive sleep apnea. When they lie down, the
They
respiration,
have, yes,
oxygenation, and everything gets affected. So that's why I tell my patients glaucoma is more of a systemic problem than your eye problem.
very true.
So they have to have
And
those
that won't
parameters under
happen if
control.
you have a healthy diet and
Right.
lifestyle. So you should try to inculcate the habits that won't let it happen.
Most
Once
things,
it happens,
yeah,
try to have a timely diagnosis. Early diagnosis will what will help you best.
correct. And smoking is one more thing that they have to quit. That is an indirect positive factor, I should say. More commonly, I mean, my patients, I see it in rural population, but then definitely it does contribute to the weakening of the optic nerve along with your eye pressures.
Okay, Dr. Shilpa, that was really good of both of you to answer that. One more question, Dr. Shilpa, I think so. You must be getting this quite some time in your clinic as well. People do feel lasers can cause more side effect than good. They can lead to brain cancers and stuff like that. Can you explain that the lasers are not, what people are thinking about?
Yeah, lasers are, as I already told you, it is not nothing harmful because they are in the spectrum of range of spectrum that are harmless to the eye. So they are fine tuned and focused by these machines to precisely do what they are supposed to do in the eye. Not every laser is harmful, but then, the precautions that the paramedical person and the doctors have to take, they do take so that it doesn't affect the eye. And actually, the benefits are far more numerous than considering it as a bane for treatment.
Sure, I do believe that as well. But yes, people do come up with such questions that it can cause some other issues as well. So I think so. We are coming to the end of our session, and I have just last.
Exactly. In fact, there is a very sorry. I
No,
just
please
wanted to
carry on.
mention there is a
Yeah.
laser which is so safe that it can be still used as a treatment modality in pregnant ladies also. Where the medications
Oh.
are proven to be not safe, we have a very physiological state laser that can benefit glaucoma patients or reduce pressures in pregnant patients.
Sure. So that is there. So you are here saying lasers are completely safe, and you should not worry with you have been advised for such a treatment over here. So just going towards my last question here, that is for Dr. Bhumika. Dr. Bhumika, we see, as you just mentioned, you just said that, having the semi-cooked vegetables can help when it comes to, having that vitamin, to procure that vitamin. But when it comes to older generation or older people, they have the issues of digestions and all. So they still recommend them having, such items in their diet?
See, the older patients, if they are having their teeth is intact, they don't have a digestive problem as such, fruits and vegetables are never going to harm them. That's my personal
Okay.
experience too, that fruits and vegetables are never going to harm them. The problem comes in macros where the carbs are too high or fats are too high, or in fact, the proteins are too high. That creates more of a problem. Fruits and vegetables generally don't. Yes, if they have a problem in chewing, they'll have to need some alternate way to use it, maybe juice it or maybe puree it or something like that. But then cooked veggies shouldn't be a problem. And raw fruits like banana, papaya, mango, I don't think it's going to be a problem for anyone.
So thank you. I think so today it was really, we got some really good information out of you both, and you have been a very graceful, what to say, speakers that came up to us. And it was very good for making our audience understand how they can keep a check on their glaucoma condition and manage their health with proper diet. I'm sure our today's audience would have got enlightened with the significance of eye care and how prevention is of more importance as compared to, just focusing on the disease aspect. So thank you both of you for giving us your time and educating our audience about it. Thanks a lot, and we'll surely catch up with you again sometime on some other topic.
Pleasure, Dr. Isha, and it was very well moderated by you. A brilliant session, I should say.
Thank you, Dr. Bhumika,
Okay.
and thanks, Dr. Shilpa, for your
Thank you.
time.
Thank you,
Nice to
Dr.
having you, Dr. Shilpa, here. It was really enlightening.
Me too. Actually, in fact, I was going to try those cooked veggies. I think there's a separate steamer for that, right?
Yes, definitely. Please do try. And actually, personalized diet is always going to help you all, whether be it a child, be it an adult, be it an old age. If it's personalized for you, it will take care of nutrients. Yes, do try those steamed veggies and those uncooked nuts.
Thank you so much.
Thanks a lot.
Okay.
Thanks.
Bye.
Have a
Nice
great
session.
evening.
Thank you.
Bye-bye.
Bye. ಆಯ್ತಾ ನಿಮ್ದು ರೆಕಾರ್ಡಿಂಗ್ ಸಾರಿ ಸ್ಟಾಪ್ ಮಾಡಿ ಸಾರಿ ಇತ್ತು ನೀವು ಹೇಳ್ತೀರ ಅಲ್ಲಿಂದ